Hi everybody, Dr. Joseph Cipriano here, also with my wife, Mama Cip. Just kind of sporadically came about doing this live video today. I know we did a Q&A last time when everybody was around, and it ended up being quite a bit of a huge success. So I did want to also go back and start this up again. I know a lot of times so many people had so many different questions, and it ended up going a lot longer than what it should have, but that was just meant to be. There's so many questions that people had, and I wanted to do that again. Alrighty, so I'm already seeing some questions pop up. What steps do I take to become a chiropractor? So originally what I had to do is I had to first get a bachelor degree, because in the United States, majority of the states require you to already have a bachelor degree. Granted, if you're already grandfathered in, you don't need that, but for, the normal, yes, you're gonna need your bachelor degree, and then on top of it, it's another 4-year program to get your doctorate in chiropractic. So it is actually quite an extensive degree. But yeah, it's definitely well worth it.
Okay, can a client request a specific adjustment?
Of course. I have a lot of clients that come in that ask for specifically like the ankle adjustment that I do, or any type of, if it's like a shoulder, elbow, or wrist adjustment, I do things like that. So yeah, there's definitely exceptions to everything.
Okay, how are you making it out from the hurricane?
So as of right now, the hurricane has not hit Greenville yet. It got a little windy, but there hasn't been any rain. We're not getting any rain or any actual storms until tomorrow. And actually, I think that's coming like tomorrow, later afternoon. Now, granted, on the coast, yeah, they're getting slammed pretty good.
So Plausible is asking for both wearing makeup. I'm wearing makeup.
We have 2 lights that are right here that are kind of, we're trying to create some better lighting for you guys in our loft. So yeah, the lighting may kind of make some little bit of effects on us.
Okay, so Mateo is asking, is there any college classes to take for aspiring chiropractors?
So one thing that I've told many people, especially when wanting to get a chiropractic degree, and a great undergrad degree would be anything in like a rehab type thing, or any type of kind of like strength training, any type of activities like that. They have like a sports medicine, any type of degree, like any type of biomechanics. Those are all great classes that you'll definitely use and definitely utilize with your degree.
Mm-hmm. Is there any college classes to take for aspiring? Oh, I'm sorry, I just read that. Can you please fly out to Los Angeles to see patients?
So I am in the process of trying to figure out different states and the bylaws, because I would love to come out to different areas and be able to do adjustments on people. I'm not licensed in California, but there may be ways to still be able to see patients on like a temporary type status.
Okay, we got hellos from London. Hello.
Hi everybody from London.
Thank you for joining in. Live or die. Hey guys, I guess this is a regular thing now.
Yeah, we definitely had a great response with doing the live video, so we're gonna try to do it a little bit more often. Trying to do it at least maybe once a week. It's hard for me to get back to all your questions on YouTube. That it's with filtering through everything on there, it's just pretty tough. And a lot of my good viewers like you guys, actually have legit questions that you'd really like to get answered.
Okay. Yo man, you're one of the best on YouTube in your field. Keep making awesome videos, man. Nice live stream, by the way. Nice to see you are okay. That hurricane is a beast for sure.
Yeah, I know that hurricane is definitely coming through, and yeah, I'm definitely glad that we are this far inland, because yeah, there's gonna be quite a bit of issues going on. Yeah, definitely pray for everybody out there who is getting slammed with the hurricane and with this weather.
For sure, and it's so unpredictable. I was supposed to come here, like Thursday, and now they're saying Saturday or Sunday.
Yeah, about Saturday afternoon is now what we've been looking to kind of expect.
Okay. How many ounces is that water bottle?
This one is a growler. This thing is huge.
It's a monster.
Yeah. Technically, I don't remember this one. I love this company though. They give me all their water bottles. They have amazing ice packs. They have even a mattress now that they do everything. Like these guys, water, everything stays cold for up to 36 hours. So definitely great stuff. I have it with me wherever I go now. Never run out with this guy.
Okay, Ballroom, do you do jaw adjustments?
Yes, I have done many jaw adjustments. Typically, I'll first do a muscle testing type adjustment, just depending on that TMJ, what type of TMJ issue one is having. I also do it's with an instrument adjustment on the TMJ, or there is also a manual manipulation. Typically, that's not an adjustment that I do all the time, but when needed, yeah, it'll definitely be done.
Okay. To be a chiropractor, do you have to have your own practice or do you apply for jobs?
So technically, majority of chiropractors out there are working for established clinics, just because it is hard to go out there on your own and establish something, especially when getting out of school with already all like the student loan debt that you've accrued, and then it's, with opening up a business, getting patients, the marketing, the advertising. There's a lot that goes to it. So typically, like a new doc would get out and they typically work for somebody for a few years. So they can start paying their loans back, start, building up patients of their own. So then when they branch out, yeah, the goal usually for chiropractors is to eventually have your own office.
Okay. Can a client request an adjustment from head to toe, toes to hip, neck, ribs, etc.?
Yes. I do adjustments literally from head to toe. Yeah, I will do rib adjustments. I will do clavicle adjustments. I'll do scapula adjustments. I'll even do soft tissue work on patients. A lot of people don't realize that, especially when it comes to chiropractic, you do have to look at the soft tissue, the muscles and the surrounding ligaments. If things are taut and tight, that can be pulling, the spine and things in a certain direction. So once we relax, a lot of, that taut and tender muscle, we can actually get a better adjustment from that.
Okay, Emil said, I see you most of the time doing neck adjustments facing down. Neck adjustments is better facing up or facing down?
Now, technically, I do neck adjustments either facing down, facing up, or actually seated. Technically, I switch things up. The only reason I do that is some people, they move easier in a certain position. So if I can tell that, like, just say if a patient is laying like face up and I go to adjust their neck and I can tell they're like really like holding back, well, there's no need for me to try to just like go through that. So what I'll do is I'll put them in a different position. It'll help just kind of in the back of their head. It'll get them more relaxed. So then when I do a different technique, it actually will be easier on the patient.
Okay, Steve is asking, what's your favorite part of being a chiro? Great content. Look forward to see you continue to grow.
To be honest, my favorite part of being a chiro is actually watching and seeing people reach their goals. So when we have new patients come into the office, typically we'll have them, they'll go through the entire day one process. I'll figure out their goals, why they're coming out to see me. And the best is, when you see that person reach that goal and attain that goal, and then it's then wanting to set new goals even higher. That's actually the best feeling, when seeing that happen.
Okay, somebody's asking if you listen to Scandinavian metal music like Children of Bodom, Amorphous, In Flames, Soilwork?
I have not actually. I can definitely look into it, but no, I have never actually even heard of that, but I could look into it. I'm always open to any type of music.
Okay, Cynthia, can you fix migraine headaches permanently, or is this a session treatment?
So now technically, I've helped a lot of people depending on the type of migraine that they're having. I've helped people where instantaneously their headache went from, like a 10 out of 10 and then boom, like completely shut off within that adjustment within seconds. And then there's been other patients where it's taken, a few adjustments and then finally they started realizing like, oh wow, I went from having, headaches, weekly to every other week or to every 3 weeks and then monthly. So it depends on the patient with that.
Okay, somebody's saying, family doc here, have you ever seen MDs at CMEs, and do you think there are any adjustments we could safely perform without too much effort?
So I have a lot of, not a lot, but I have multiple medical doctors that are patients of mine. I have surgeons, I have actually even a couple orthopedic surgeons that are patients of mine. And I even have orthopedic doctors that send patients to me because they require their patients to go through chiropractic care before, if they need to go, if they're attempting to get a back surgery. So I actually work hand in hand with a lot of medical doctors and orthopedic doctors. As you're saying in that, when I'm doing education, I'll there are some, the continuing education where we do cross path, and never been an issue. I've, never really had any medical doctors, look down on me by my profession or what I do. To be honest, I've had more doctors that tell me thank you and actually are happy for what I do, and they're grateful that that I can help people, and I work hand in hand with medical doctors. So
Okay, Ryan is saying, is it worth being adjusted even if you don't suffer from any pain?
yeah, we have like your typical maintenance adjustment. With the maintenance adjustment, all we're just making sure that there's no pressure or anything on the nerves. You got to realize that pain is one of the further symptoms that one may have, like down the line. So if you don't have pain, that does not mean always that you don't have a misalignment. So, over time you may not even experience that, but yeah, I would definitely recommend. Now, granted, I wouldn't recommend, if you're not experiencing any pain or any major issues, there's no need to get on like a 3-time-a-week plan. Just your normal once-a-month adjustment would be completely fine.
Okay, Ivar is asking, how successful is chiropractic treatment for a herniated lumbar disc?
So with the herniated lumbar disc, what I like to do is I like to take films on the lumbar vertebra. I can see exactly how the disc, if it slips forward, backwards, to either side. And there are different techniques that actually help specifically with the disc. It's a COX, C-O-X, flexion distraction technique. And what that does is it pumps the lumbar vertebra. And what happens is it helps bring fluid into the disc. I've actually personally had many great results with it, and even myself, I've done the Cox flexion distraction, and yeah, it's actually works really well.
Okay, Tony is saying that's a very cool water bottle, Dr. Sip. Where did you get it?
This water bottle is from the Coldest Water. I will actually put up some links on my video. They actually do a weekly giveaway all the time. So yeah, if you guys sign up, you can win free water bottles, free gear, things like that. So I'll definitely put the links up. Actually, we can see if my wife can if you can say something, maybe put that link up and we'll get that up for you guys.
Yeah, one sec. Set something up on a site where people can send you a chiro-related question for $1 or something, even just have a donation option. Your time should be compensated in some way.
Well, thank you. Technically, I don't mind doing things like this just because, I know a lot of people do have questions. On my other videos, there are ads that do pop up, and that does help compensate for the time in doing the videos, so I definitely don't mind.
Take that for just a second. Let me link the link.
So my wife is going to link in the link to the Coldest Water. And let's see, I will take charge on her phone and look at some questions. Okay. So I am seeing, is it mandatory x-rays before any kind of adjustment? So now technically I do x-rays before every patient and any type of adjustment, just because I like to see where there is a misalignment and exactly what's going on. Typically, you don't know if somebody has a congenital abnormality, and you don't want to be adjusting blindly. So I always do a full set cervical, thoracic, lumbar films on all patients at the minimum. Okay. Yes, I wish I lived closer. I know I do hear that quite a bit. Somebody calling me a fake public agent doctor. I'm not fake. I am real. My wife is real. We are real people in Greenville, South Carolina. Okay, somebody asking me if I could talk more scientific basics for my technique. So I guess it depends on what is actually going on. Depending on if it's the lumbar spine, I do a little bit more with I do a torquing on the sacrum. So I do a drop technique that I think you guys are probably pretty familiar on, that I perform on patients. And then the other technique that I would say that you're probably asking about would be the Y strap. Now the Y strap, that's a manual decompression. What that is going to do is that's going to decompress the spine from the all the way up in the cervical region at the occiput, going all the way down. Now granted, it's going to depend on the strength and the force in which I pull back. So typically what I'll do, especially with a new patient who has never had a Y strap done before, I will not pull and I will not use full force. The only reason is I want to get to know their body. I want to test it. I'd rather go light. If they respond very well to it, then the next adjustment, I'll use a little bit more force so we can get a little bit further down in the spine. We can decompress even more of the spine.
Live or die, I would have liked x-rays before the last chiro messed with my neck and caused my jaw to lock. I would like to know about x-rays too. Should you steer clear of chiros who don't offer x-rays when you have actual injuries?
Yeah, I'm not trying to be mean at all, and not trying to put down any other chiro, but my way, my philosophy, I take x-rays even if you are a healthy, 25-year-old person who's never been in an accident. I still want to see what's going on. There's so many different congenital abnormalities that, could be present, that I don't care how much you palpate and feel up and down the spine, you're not going to see if there's a congenital abnormality. And that's not something that you want to fool around with. Being a chiropractor and doing a manipulation on one spine, it does cause a lot of change. And if you don't know what you're doing, or you can't see what you're doing properly, then I would recommend not doing it at all.
And actually, I know a lot of you have always asked why he doesn't show x-rays or do them before adjustments.
Oh, yeah, I don't, to be honest.
In the videos,
yeah,
they are done before.
Yeah, in the videos, I don't always put up one's x-rays. And just because a lot of the times, if there's something going on I don't know, it's weird. Some of the patients, they're like, no, you can put me up, but, not my films. I'm not trying to, I don't want to do anything weird. If a patient doesn't want me to put up their films, then I won't put up their films. So I have no problem with that at all.
Ranger, how often should I get a full body adjustment? Is it possible to have one too often?
No. Typically, if you have no symptoms or any true complaints going on, how I like to get my patients, in the beginning I may see them, like 2 times a week. And for about the first month. After that, the goal to get a patient is to see them 1 time a month. And that would be your typical maintenance type plan, is once a month is the goal for everyone out there.
Okay, Daddy Cat. Hi, Dr. Cipriano. I was wondering if you could talk more about the scientific basis for your technique.
Did you
do that one?
Yep, I did that one already.
Why is it that when people get a ring dinger, their face is in total amazement, but when people get your Y strap adjustment, they don't have the same reaction other patients do when they get the ring dinger?
So with the ring dinger, that the patient's hips are completely locked in on the table, what happens is, as you can tell, the force that Dr. Johnson uses, he lifts people almost off the table. He does more force than what I do. Now, granted, when it's a patient that I've adjusted multiple times and I have a feeling for their body, I'll use that same amount of force with the Y strap. But in the beginning, if I don't, if I'm not comfortable, with that patient getting that strong of an adjustment, I don't want to hurt or injure any patient out there. Because everything that I do, it's all filmed live. I don't really edit anything. Everything is always straight through. I walk through an adjustment. As you guys know, usually there's something wrong with the audio or the video. Like my things that, they never come out great, and it's because it's raw. The only thing that I'll put in, I'll put my name on, across the front, or some little things that pop up, but that's it. Like, there's no editing of my videos, so I don't want to actually hurt anybody, especially with doing a maneuver.
Someone's asking how old we are, and most importantly, when are you going to shave that beard? Never?
Wife will not let me shave the beard,
Beautiful.
I'm 31. I know I look young, but yeah, born 1987.
All right, what do you know about Finland? Love your videos.
What do I know? To be honest, I know nothing of Finland. Yeah, I know it's, way off, kind of far from here, but yeah, no, to be honest, I know nothing about Finland.
Okay, hello, Dr. Cipriano. I'm from India, and I love your videos. I wish I could meet you someday in person. Love from India.
Well, thank you. I have had many people from India reach out asking me to come, over there. I would love to look into the laws, and to be honest, I really don't think there are too many laws, considering with all the, like Indian barber or whatever they call it.
Oh, yeah.
So to be honest, yeah, I could probably come out there.
Those are rough.
Yeah, those are quite funny, but it is what it is.
Okay, Dr. Cipriano, would you say that you subscribe to subluxation theory, and if so, it's been discredited, I can't read, by all serious scientific sources?
So, to an extent, hold on, babe, scroll down, let me see that.
Go ahead.
So, to an extent with that one, just because I believe that the nerves, they exit the spine, and like how I always describe chiropractic care to a patient is, your brain controls the entire function of your body. So in order for your heart to beat, your lungs to breathe, or even a simple cut in your finger to heal, that message comes from your brain, it goes down your spine, goes out the nerves to every organ, cell, and tissue in your body. If your head's cut off, what's gonna happen to you? You're gonna die. If the nerve to your heart is cut, what's gonna happen to your heart? It's gonna stop beating and you're gonna die. So if there's pressure that's being put on the nerve that's going to your heart, over time, would it get better or is it gonna get worse? More than likely, it's gonna get worse. So what I do as a chiropractor, I want to remove that pressure off the nerve to allow your body to heal and function as God intended. So that's my theory on chiropractic, and that's always how I educate all my patients. If you want to call it a subluxation, if you want to call it a pinched nerve, if you want to call it, nerve interference, that's just how I describe it. Any interference of the nerve that causes, loss of function. All I'm doing as a chiropractor is removing pressure off the nerves to allow your body to heal and function as God intended.
Do you believe that it's important to practice evidence-based medicine?
To be honest, all right, so with chiropractic, this is a tough one, especially in the chiropractic field, because there are many techniques when it comes to evidence-based medicine. You gotta realize, chiropractic isn't, it's not like you can do as much evidence-based, where it's not like, okay, we're gonna set a trial, we're gonna find, 100 people in their 40s with, diabetes and whatnot, and we're gonna give them this pill, and everyone takes a certain amount of this pill, and you can actually test and see the results. Now, the only thing different is when it comes to chiropractic and an evidence-based, society, not everybody is going to have the same misalignment, wherever it's at in your body. So if I make an adjustment, to somebody's atlas, it may make wonders for one person and it may do nothing for another person. So it's really hard to describe or to get as much evidence based.
Okay. Hi, doctor. Would you say that the vest is an important part of modern medical gear?
Actually, the reason that I wear the vest, well, as you guys know, I kind of went through a little chubby stage after my wife got pregnant and we had our son.
Don't you dare blame that on me.
And, I didn't want her to put on all the pregnancy weight. So I myself, as being a good husband and, loving husband, I also put on my own pregnancy weight. So the vest, that kind of hides everything for me a little bit.
Is it possible to practice this work without official studies?
I mean, granted, anyone could do anything. You could, like, if you wanted to be a surgeon, you could cut into something. I mean, it's as simple as that. But no, the reasoning of the schooling, to be honest, is more about knowing the effect of if I make an adjustment up here, what that nerve is going to, what it can affect elsewhere. So a lot of it is actually the pathways and learning like the afferent, the efferent, learning your CNS, PNS, and just learning all different pathways of the body. Is, to be honest, it's very kind of a grueling type degree where a lot of people think it's like just an easy blow off type thing, but it really wasn't.
Anyway, I can do the Y-axis procedure myself.
Not really. Technically the Y strap is only allowed to be bought by either a licensed chiropractor or a licensed physical therapist, or obviously a DO, a doctor of osteopath. Those are the only 3 degrees that will allow one to purchase the Y strap. So I have had many people talk about that or ask me about that, but yeah, to the general public, you're not going to be able to find that.
Okay. What's the deal with people always getting people to stand on their backs? Why is that causing relief? Why is it wrong?
Well, a lot of times, so, I mean, I actually had a patient here, and he was telling me that his mother would stand on his back. Now, the reason that he would have his mother stand on his back is there were, bones in his spine or ribs that were out of alignment. Now, granted, if she steps on the right bone and puts something back in alignment, like 2 thumbs up, that's great. But if she steps on the wrong bone and puts something like even worse out of alignment, then, you're SOL, that happened. So I would definitely recommend coming into an office, getting x-rays done, seeing exactly where that misalignment is and fixing it, properly.
Paige, I've had daily pain at the base of my skull for years with no diagnosis or lasting treatment. I started cracking my neck because of the pain, and now I do it multiple times daily. It must be making it worse.
So now technically where you're saying you're feeling that pain at the base of the head, at the base of the skull, so it could be, an occiput or atlas axis type misalignment. What happens is there's so many, little nerves that are right there that can cause, headaches, any type of issues like that. But yeah, getting a set of x-rays done, you'll be able to see exactly what's misaligned. And now what happens when you do that self-cracking, what may happen, if you do like one of these or, one of those type thing, you take your hand and now what you may be doing, you may be pushing a vertebra further out of alignment than where it should actually be. So, I mean, making a neck pop or crack isn't really gonna, always be the best bet. You do want to put it back into the correct alignment.
She's saying, how can I help myself?
How can you help yourself? I mean, you can always do different stretches, neck flexion, neck extension, your lateral bendings, going through a range of motion. There are different neck stretches. I mean, you can always even do almost like a self-massage. Sometimes, if it gets bad, an ice pack on the back of the neck can always help too. But typically, if it's something that you've been experiencing and you've been feeling like cracking like that and like you've been doing it, I would recommend, actually getting films done, especially, in that cervical region and seeing why you're having pain.
Okay. How long have you had your practice, and did you graduate and go straight into chiro, or work another job then go to school for it?
No, so when I graduated, I moved to, it's called the Woodlands, Texas, which is about like a half hour north of Houston. And I was working for a chiropractor over there. And the office that we were at was actually, I think it's the largest office in the world. We were seeing 2,000 patients a week out of that office. And it was, the amount of adjustments that I was doing, the experience, the training, the knowledge, it was, to be honest, it was an amazing experience. And, that gave me, obviously the techniques now that I use, I've learned from at that office. And I was able to, go out and be able to do something of my own.
Okay. How long were you letting your beard grow?
I've had my beard for, I don't know, babe, how long have I had my beard for? 3?
About 3 years.
About 3 years now. I trim it up because, as you can tell, if I if I actually let my beard grow for 3 years, it'd probably be a little bit longer. Yeah, I trim it up every now and then, but right now I've kind of let it grow a little bit. My parents aren't really the biggest fan. My family isn't really the biggest fan, but you know what? My wife likes it, so, we do what wifey says. Happy wife, happy life.
Exactly. All right. Any tips on improving posture?
Yes, when it comes to posture, all right, so a couple things. One, to people that are driving a lot, I definitely recommend, some type of lumbar support, or even rolling up a towel and putting it in the low back, just helping get that support with driving, or even if you're sitting at a desk for a while, having some type of lumbar support will really help. Also, if you have like a desk type job, to stand up, to sit, stand up, sit, kind of do that throughout the day, just so you're not stuck in one position all day. And then just always try to be self-aware and conscious about things that you're doing. If you need to stand up, bring your shoulders back, bring them up, just relax. Like feel free and do that, just stretch out a little bit.
Ashton is asking for tips on improving posture.
Okay, there are different stretches and exercises. Definitely, like I was just saying, doing some lumbar support work. Now, granted, there are some things, what I'll do a lot of, especially at the end of the night, if you lay on your bed and you let your neck roll off, like if you hang your neck off the end of the bed, you'll get a really nice stretch, and what'll happen is, that's the curve that your neck should have. So when you start to have that curve in that spine like you need, it tends to take pressure off the nerves.
Okay. What do you think about the vaccine debate?
To be honest, vaccines are, you can go either way with it. I always tell everybody, do your research. Like me personally, I grew up and I was vaccinated. Now my wife, nothing. Our child, he has no vaccines, but granted, I did grow up and I'm perfectly, healthy and whatnot, but
You do have to realize, though, those vaccines are constantly changing.
correct. And, back in 1987 when they were giving out vaccines, they were way less amount of vaccines that were given. Just anyone who is a parent who does, just to have a child, if you are wanting to vaccinate your child, definitely go free, go right ahead. I always tell people, educate, learn a little bit, and just remember, you don't have to get every vaccine at one specific time. You can spread it out. Just remember, a child, they're tiny. If you want to vaccinate your child, instead of getting everything done in, 2 months like they want, you can spread that 2 months out to a year. That's not going to be an issue. It's not going to change anything. So, definitely look into things like that. And, Yeah, I mean, if you ever really want me to get more in depth, typically I don't really like to get into a controversial type subject like that, just because there are so many people pro or, or against it, but, that's kind of my own feelings for it.
What is the difference between Gonstead chiropractic techniques and regular? I don't know if that question makes any sense, so if it doesn't, what is Gonstead chiropractic?
So Gonstead is a specific technique. They do cervical adjustments, there's thoracic, there's pelvic. You'll see, if I remember correctly, I haven't really watched too many of that Dr. Rahim, but I'm pretty sure he's a Gonstead chiropractor, and he'll do the adjustments in the back, like in the mid back, and he'll do the adjustments like in that really awkward position where you're kind of like bent on all fours. It's just a different technique. There's like how I practice is a combination of multiple techniques. I'll do a little bit of full spine, a little bit of Gonstead, a little bit of Thompson, a little bit of diversified, and then a little bit of Pettibone. So I kind of have a mixture. I took a little bit of each technique and brought it to kind of my own way in my what I see with patients where they respond very well to my care.
Brian is asking if you're still sick and who does your adjustments.
Yeah, so I was not in work today, and I got sent home actually yesterday. No one wanted me at the office. I ended up, there's been like a virus going around in South Carolina, and I had a fever, so everyone at the office said, bye, like, get out of here. So no, I was not at the office yesterday or today. And yeah, so I've been fluctuating, going into like low hundreds and then dropping back down to, your normal 98.6. So, I've been just right here staying hydrated and just kind of relaxing.
Okay, are you familiar with Dr. Ian and how he got in trouble? What's your take on this situation?
So the only, I was not familiar with him before. I have watched some of his videos, and to be honest, I know he did get in trouble for that infant adjustment that he did. And the sad thing is if you watch the actual full video, that child responded very well to care and actually was very beneficial. But the actual adjustment itself, yeah, it was a loud pop, and as you can tell, it scared the child, and it's a child, any loud noise is gonna scare him or her. So that the child heard the loud noise and boom, started crying, and then you had the news and the media get involved, and granted, I think anything that happened to him is awful, because he definitely seemed like a great doctor, and I could have only imagined the amount of videos that he would still be posting today if it wasn't for that.
Okay. Can you use your beard in place of a white strap? Eventually, maybe.
Yeah, eventually if I grow my beard long enough.
What's the ideal position to sleep, pillow or no pillow?
So now, me personally, I guess the ideal position is on your back with a very small pillow below your neck, a very small pillow in your low back as well, and then even a pillow under your knees. But personally, I could never sleep on my back. I am a side sleeper all the way. Side sleeper, even rolling to on my stomach, which on your stomach is like the worst position to be in. If you lay on your side, what you want to do is you want to have a pillow the width of from your ear to your shoulder. So you want to get a pillow so you keep your spine straight, aligned, and then you want to get a pillow for in between your legs, so your knees don't touch. And that is actually a great position, and that's typically how I fall asleep at night every evening.
I think this one kind of answered that question. He said, what's the best way to sleep and reduce neck pain? Also, do you have any recommendations on pillows for neck pain?
Gotcha. Yeah, I mean, actually, if you guys want, this company, they did actually make their own brand of pillows and mattresses out there, so definitely one thing to look into. But yeah, make sure and get that pillow that's from your ear and width to your shoulder, and you just want to keep your spine straight and aligned.
Okay, I fell off a ladder back in December 2017. In January, I woke up with my hands in so much pain. My thumb, index, and middle fingers have been going to sleep every single night since.
Okay, so that right there is telling me that you're having an issue with your C5, like your nerve roots, C6, C7 nerve roots. So it's happening when you're having numbness and tingling in your finger. Obviously, you didn't fall, and it isn't from whacking your hand or something on the ground. What happened is there's now something in your neck that's causing pressure on the nerves. So if you're to get an x-ray taken, and with that x-ray you'll be able to see how the spine is misaligned and how it needs to be back in alignment to take pressure off the nerve. Usually when it comes to an accident like that, or like an instant, like a fall, like a car accident, something like that, typically the main thing is going to be, one, to get you out of initial pain. You want to do that acute care work, you want to ice, you want to, just relax everything. But to fix that usually will be, a quicker time frame, just because it's something that happens so quick, you can usually reverse that quite well.
Okay. What's the best way to find someone in my area who uses the Y-strap?
That is a hard one. I've had so many people ask me about other doctors that use the Y-strap. Maybe I'll try to get together and try to put something together and find doctors across, even across the world that are familiar with that technique, or, maybe even I'll create something of my own that can actually reach people, something like a database where you can type in, like where you live and see the nearest Y-strap doctor to you. It'll just take a little bit of time on my part, though.
That's eventually our goal for his website.
Yeah. So we've been trying to update the website, www.drjosephcipriano.com. Always trying to update things. It gets hard, because I do everything that on my own and myself. So just updating things, is a little bit of a slower process, especially with being involved in so many different things going on right now.
Okay. Do you watch the NFL?
I try to watch the NFL as much as I can. Originally from Detroit, so I am a Lions fan. Usually not the best team to watch, but they were great. I loved watching them when they had Megatron. Always a fun time then. But no, to be honest, this season I have not watched one game yet, which is awful for me. I've just been so busy, but that will definitely change.
Okay. Does your wife have a sister? I have 7 sisters. They're all married.
7 sisters all married. I mean, could you, you can kind of imagine, you have my wife who is this beautiful.
Oh, stop it.
The rest are all just as attractive.
Okay, I have low back pain. I'm 18 and can't sleep at night.
I'm awful, that's awful to hear in general, especially being, at such a young age, at the age of 18. I know, especially at that age, a lot of times, you're still probably, under your parents' insurance, may not even have an actual job yet. So a lot of the times, chiropractic care can definitely help. But even then, you'd still want to go through, an exam and see exactly what's going on. One thing, especially that may be a little bit, more cost effective, maybe trying a really good massage and getting, some soft tissue work done, especially on that low back. That may be a good first route to go. That may be, a more inexpensive way. But yeah, if money's not an issue, definitely look into the chiropractic path. Or if you do have insurance, majority of, a lot of offices do accept insurance. So it may not be much of anything, may just be a copay.
Justin is asking, why was I warned about loss of bladder and bowel function due to my injury, and how serious is it?
What kind of injury did you have? If you ask again, I'll kind of take a look and see what that is. Yeah, typically, if you have loss of bladder or bowel injury, yeah, we're definitely dealing with a more serious issue. But yeah, so I mean, if something like that is to happen, now luckily at my office we do have an MD and a nurse practitioner on site. So if I was to come across that during an exam, that is something that I will, kind of red flag and let the MD know as well, and they'll go a little bit further in detail with that.
Oh, Justin just responded. L1, S5, herniation.
Okay, so the lower in the sacrum, in the sacrum, yeah, you can have that can affect bowel bladder type issues. Now, are you currently experiencing that, or was it just a question that someone was asking?
Okay.
And we'll get back to that.
Do you know SoCal Chiropractic, and what are your thoughts on him only adjusting the neck?
I'm not actually familiar with SoCal, but how you're saying he only adjusts the neck. So what that would be is there are certain techniques, and another technique is an upper cervical doctor, meaning they really only focus on the atlas and the axis, the top two bones in the spine. And the reason they only adjust that is if these two bones are aligned, the rest of the body will realign itself. You got to realize that your brain is exiting that foramen magnum, and right as it exits the foramen magnum, that brain stem can get pinched right at those top two bones. So what would happen is if everything is cleared all the way up top, then everything else will follow accordingly. Now, granted, it does work. There are a lot of very successful, upper cervical doctors. Myself, I like to adjust the full body. I like, if there's a misalignment in the middle of your back or in your low back, or, even in an extremity, I like to adjust everything and help everything at once.
Okay, Justin responded. He said, pain in the gut, currently getting spinal decompression on a machine weekly.
Okay. Well, I'm glad that you're not having, any bowel or bladder, like mishaps or dysfunctions, anything like that. But yeah, pain in the gut, that decompression, that lumbar decompression, those are very nice. Even at our office, we have like a similar. I don't know what type of decompression you are currently on, but ours, it has a harness. I'll hook you in at the waist. And it'll flip you upside down, and you'll get that tension, like that decompression throughout that lumbar spine really well.
Okay, what's the common or average pricing for a full adjustment without having insurance, and does health insurance cover the cost of an adjustment?
So technically I can't really speak for everyone out there, because you have some people that are very, very cheap, or some people that are very, very expensive. I would say, we make things more average. So typically for our initial exam, now what that consists of your, full set of x-rays, orthopedic tests, a full medical exam as well by our nurse practitioner. We charge $100 for that initial exam, and that's if you're a cash patient. And then we charge $40 for a single adjustment, or $59 for 3 adjustments per month. So our cash plans are rather affordable. But yeah, we also have some patients where they come in and their health insurance covers their chiropractic care, covers their physical therapy, covers their exam, covers their x-rays, literally covers everything. And they may only have their copay to make.
Somebody just asked, do we work
out? Not as much as we should. If anything, we really like to try to do a little bit more, just activity. We'll try walking a lot more. We've got a very nice trail in Greenville that we would like to walk to the downtown Greenville. But yeah, no, to be honest, I haven't really hit the gym as much as I wanted to. Now, I used to be as what I guess one may call a gym rat. There were times where I was completely jacked and ripped, and as of right now, it is not one of them.
Okay. How to correct rounded shoulders?
So now there are many different ways. Some things to actually look at though is the actual skeletal makeup. There are some people where I've literally seen their scapulas are rounded. But a lot of the times what can be done is if you strengthen your rhomboids, what'll happen, it'll help start pulling your shoulders back. So that's always a good thing to look into, is strengthening of the rhomboids.
Can chiro help with teeth alignment, having enough space for all your teeth, etc.?
Honestly, I have not heard that one. Now, granted, I've helped with TMJ issues, lockjaw, things like that, but never with actual spacing. To be honest, I've never really been asked that one. But yeah, I mean, you know, some people they do have enough space, whereas me, I only had to get one tooth removed, and the other three grew in completely fine, no issues. So, you know, it really just depends on the person.
A month ago, I was playing softball and I took a serious fall. I landed on my shoulder, and now to this day, I have pain and a bump on my collarbone. Do you know if something's out of place?
There is a good chance that something is out of alignment. You know, there are a lot of things. It depends on the fall. Did you fall with your arm up? Did you fall with the arm down? It could be, you know, it could be any type of, you know, rotator cuff injury. It could even be as bad as like a labrum tear or something like that. You know, you've got your AC joint, your acromioclavicular is what that stands for, your AC joint. You have misalignments that could be from the scapula, you know, or it could be an SC, which is your sternoclavicular joint, which is in here. That could be something that got misaligned. You got to realize there's quite a bit of muscles and ligaments that make up that entire shoulder girdle process.
And then he also said it hurts if I pick something up that's heavy, and there's a bump on my collarbone. The bone seems swollen from the fall I took on my shoulder from softball.
Okay, yeah, it could be some type of AC or SC kind of misalignment that happened. Now, hopefully, you know, it isn't a tear. You know, sometimes, you know, tears may have to be surgically repaired. But usually, you know, you'd be able to see your clavicle, you know, kind of spraying up in the air if it was torn. But there are partial tears. It depends on the length of time. You may even need a sling or something to mobilize it for the time being.
Egomaniac said, Mama Sip, I'm so proud of you two. Great, wholesome young couple making their way in the world.
Yes.
Thank you.
Yeah, thank you. Yeah, we're always trying to make our way.
Always trying to grow.
Always trying to grow, and, you know, always trying to help others. You know, I always feel, you know, the more I help others, you know, the more you guys help us.
And then Silver Symbol said, great channel and videos. You guys are both awesome. Thank you, thank you.
Thank you, thank you.
Doc, which beard products do you use? It really looks rad. Or it looks really rad.
You know, I've actually always used multiple. I haven't really stuck to one specific product. Sometimes I'll use, and what is it, babe? That argan oil? Isn't it that I use in my hair?
Yes.
So I use like an argan oil that I put in my hair. Mm-hmm. So sometimes I use what's in my hair, and I'll just use that same for my beard. I used to have other products, but yeah, typically I've just been using the argan oil.
Okay, going back to that one question with the baseball.
Okay.
He also said I fell with my arm down. If I pick up something heavy, it hurts the back shoulder. If that helps any.
Okay, yeah. I mean, depending on what's going on, you know, it could, with a fall like that, fall with it down. You know, I really got a feeling it's going to have something to do with the AC joint. Now, what a big issue is right around that joint, there's a muscle called the supraspinatus, which is a muscle it's very thin right around that AC joint, and that could be the muscle that is the one that's mainly getting affected right now. I would definitely start with the, obviously rest it, ice it, any type of compress on it is gonna be good. But definitely, do the icing stage right now. From there, if it's still something that's been bothering you, I would definitely get it checked out. There are x-rays that can be done to see if it is an AC injury. You'll see more gapping in the x-ray. So those are definitely things to look into.
Okay, somebody's asking if we are married.
Of course we are married. Yes, we are.
Okay. Does the fact that my chronic pain at the base of my skull is alleviated during traction indicate anything, or does traction generally alleviate all pain due to lessening nerve compression?
No, actually, so
It's right here.
okay, when you do get that alleviation from having that neck compression, if you were to get, just say like my Y strap done or like Dr. Johnson's ring dinger done, you'll definitely notice a difference. So what happens when you get when you get that cervical like decompression, like the ones where it does like a nice pulling, it is great and it will help temporarily. But what I do is, especially like with doing the Y strap, I'll pull through that and I'll actually make it into an adjustment and I'll manually decompress that spine, and you'll notice like a legit change like that. Whereas you can still get a change, with doing, with how you're doing it, like that decompression, but you won't get as fast of a response as you would with my type of adjustment, or like the ring dinger adjustment.
Okay, do you know what is a good exercise for the back?
It got to be a little bit more specific. Are we talking upper back, lower back? Any pain with, like, is it core muscles that we're talking about? Is it like for posture, like bringing the shoulders back? There's just so many different things, when it comes to back stretches.
Okay, can you correct scoliosis without surgery?
It depends. I've had so many people ask me this. There are two types of scoliosis out there. There is a functional scoliosis and a structural scoliosis. Now, a structural scoliosis means that there is some type of congenital abnormality, and no matter what anybody does, the scoliosis will always be there, and there is nothing a chiropractor could do. Now, if somebody has a functional scoliosis, what that means is a misalignment that may have happened years ago will cause a body to go out of alignment. Now what happens then, like just say you had a slip and fall, you slipped on the ice and you have one hip that's higher than the other. Well, now that you have one hip higher than the other, what's happening is your spine is gonna compensate for that low hip, because no matter what, your head is gonna sit flush and level. You never see anybody walking around with their head tilted on an angle like this, because your body is always gonna keep it level and flat. So to keep your head level and flat, the rest of your spine may have to do some adapting, which is where a scoliosis can come into effect.
Okay. Will we ever vlog? I do a little bit of that on
Yeah,
Mama Sip.
my wife on her channel, Mama Sip, she does some vlogging. She does some behind the scenes stuff during some of our videos that we do. Things like that. So yeah, she does more of the vlogging. She keeps up to date with more like current trends. I mean, especially like right now with Hurricane Florence and us being in South Carolina. So she's been keeping up with that, and she'll definitely keep up with whatever the weather tends to be where we live here too.
Mm-hmm. I'm starting that workout.
Yep, she'll be starting a workout. Getting back into shape. Which I always tell her she doesn't need to. She's perfect, but she always wants to be in better shape.
Okay. Are you using the Y strap in place of neck adjustments? I've noticed you were doing the neck adjustments very light now.
So typically when I do adjustments, the reason that I do neck adjustments lightly is the adjustments that I do on people are what I like done to myself. So I don't like to have a lot of like rotation done in my neck. My spine is typically very straight. I don't have a lot of rotation, so I don't really get a lot of like rotary type adjustments. Now the only time I'll usually do more rotary type adjustments is, once I take a film and I see that they have something that's just really out of alignment. Now someone like that, yeah, I'll do that adjustment that they need. But typically, especially in the cervical spine, just decompressing that spine is really all one needs. You don't need that twisting, especially, up in the neck. Especially with an older patient, you don't want anything to happen. So, I mean, it just depends on the person and what I see on the x-rays.
Okay. They're telling us that we're too serious and we need to loosen up a bit.
Loosen up. Yeah, I mean, I guess if you guys were to catch us out and about, but we don't usually get to go out as much as we like, especially with having a 6-month-old child. Now in a couple weeks, my parents are actually coming down here, so we've got, babysitters to take over, and we're just gonna be like, bye parents, we're gone, and we're gonna go out and we're gonna have fun.
Cannot wait for that. Okay. Where was I? Any tips for good posture for someone sitting at a desk all day? Could adjustments help pain in these circumstances?
So I'll answer the second part first. Yes, adjustments. I have a lot of people that are sitting constantly all day, either at a desk, or I have a lot of truck drivers that are patients of mine. And with people like that, one, I make sure that they have good lumbar support. Two, if it's a male, typically, men carry a wallet in their back pocket, and some men have like this really thick wallet in their back pocket. Get rid of that. That can really cause a really big hip height differential. Remove that wallet, especially during a long drive, or if you're at the office sitting. Get all that crap out of your pockets, relax. Get a nice lumbar support. I mean, you can even do as basic as, roll up a towel, put it in the back of your chair. Those are good things. And if you're at an office all day, every 30 minutes, stand up, walk around, go get a drink of water, whatever you need to do. Just, definitely you want to change up that posture.
Okay, what do you think of Dr. Johnson from Houston and his ring dinger?
I mean, it's another really good manual decompression. I have nothing against it. I know, it looks, very powerful. But yeah, no, there's definitely nothing that I could say bad, because my Y strap is, the same type of adjustment. The only thing different is, he's got that table where he straps you in where, you're not moving anywhere. Whereas I have people with their feet hang off, and, I use, the force, and I'll pull back. So it's, I get more leverage, because with the towel, he doesn't have leverage, where as with my Y strap, I can definitely get more leverage and pull, so I can, get more of a, sensation with that. So it's just, just a little bit of differences, but they still accomplish the same goal.
Okay, do you make treatment plans, or is it just whatever is bothering people?
No, well, yes and no. Yes, I do make treatment plans, and yes, it will consist of many different factors. It'll be with one, what I see on film, what type of, issues that you're experiencing, and I'll even take into effect, the cost of things. I'll typically, what we'll do at our office, we'll give, 100%, like, this is what I recommend, and it may be this plan with X, Y, and Z, and then I'll give another option, a more cost-effective type option, and, go from there. You got to realize that, chiropractic care, is needed by everyone in the world, and it really shouldn't be like a crazy expensive thing, and not everyone should have to go through the same exact plan for the same exact person. Everyone is a little bit different, and even people's bank accounts are different too. I'm not going to just prescribe something just because I know someone is wealthier than someone else. I do things based off of their films and what they're experiencing.
Do you have technique to help moving the occipital bone?
Yeah, so there is occiput adjustments. It depends on if it is more of an occiput adjustment or if it's, the C1 adjustment. Typically a lot of the times, if you move C1, you may actually move the occiput as well just because they're right there. And then with the Y strap, with that thing being hooked onto the base of the occiput, you're gonna rock that too, when you're doing that manual decompression.
Okay, I can't make it out to Greenville. Do you have any recommendations for a doctor in the Columbia area?
Get out of here. If you're in Columbia, you can make it to Greenville. I'm not asking for you to come out, 3 times a week. But my wife and I, we actually at one point we did live in Columbia.
We just recently moved out of Columbia.
Yeah, we just recently moved out of Columbia into Greenville, and it's a pain. It's about from where we lived. We lived actually right on Lake Murray, so I know you'll be able to know where that is. And yeah, where we lived at on Lake Murray, it was, what was it? I think about an hour and 45 minutes, or an hour and 42 minutes to be exact, to get to the office in Greenville. So it's not the worst, but it is manageable.
Dozan is asking, I feel like my neck is stuck for years and I can't turn it to the right or the left, and I'm afraid to do neck adjustments. Is it gonna break?
It is not gonna break, and I can promise you, you are going to feel so much relief after getting the proper adjustment that you need, and you're almost gonna want to kick yourself after dealing with what you've been living with for however long you've been living with that. It's just always crazy for me to hear people that just deal with issues and deal with pain when there are options out there for people.
Also, what's your advice on an orthopedic bed, mattress, and pillows?
So there are multiple good mattresses out there. Actually, the Coldest Water, this brand here, they do actually make a very well orthopedic mattress. We do also have another orthopedic mattress. Gosh, I can't even remember the name of it.
Chiropractic mattress.
Yeah, it's a chiropractic mattress. We have one of those as well. There's multiple different mattresses. The one thing that I can say is, you got to realize that literally every day you're spending between 6 to 8 hours, in your bed. Definitely don't be cheap and just get some $100 mattress just to get something. That'll tend to start increasing pain and issues. You definitely want to, really get some things that will cause less pain, things that are comfortable, things that when you fall asleep at night, you can actually wake up in the morning and feel relieved. If you do check out the Coldest Water, we have mattresses on our website, and also pillows there as well.
Vayfon said, I would like to get adjusted, but I have a C5, C6 fusion. Any thoughts on that?
So with having a C5, C6 fusion, what can happen, you can still get all the vertebra above and the vertebra below adjusted. The only reason you don't want to adjust that specific segment is you don't want to break any screws or affect any of the fusion that was in place. But yeah, you could definitely still get adjusted.
And Dad said, we can't wait. Also looking forward to watching our baby.
Of course, I know we are looking forward to you guys coming here and definitely taking baby Angelo and just letting us have some free time.
How does your Y strap usually work?
How does it work? So what I'm doing, the Y strap is going to go over and it's going to hook onto the base of the occiput here. And what I'm doing, I'm manually decompressing the spine. So I'm pulling the vertebra apart. And what patients will feel when you're on the table, you can get that decompression. Depending on how much force that I use in the pull is going to depend on how far down you're going to feel that, that decompression. So you'll feel the decompression go, as far as, into the base of the neck or all the way down to the, to the lumbar spine.
Christian, where did that even go? Oh, okay. Christian says, it seems like some chiros do the same exact thing for every patient?
Some things to look into with that. Granted, yes. There are some chiros, and I've seen multiple chiros. Do what's called like the flying 7, and they'll do the exact same adjustment on every patient every time, and they won't change up a thing. And granted, yeah, you'll get some relief with some patients. Others may not respond to care as well. Now, what I do that's a little bit different is certain vertebra needs certain adjustments. Now, granted, if I do something on one side, I may actually be contacting like T1 or T2, and the same adjustment on the other side, it'll look and the setup's exactly the same. The only thing different is my hand placement may now be on like T3 or T4, a different level. So it appears as if I'm doing the same thing on either side, but it actually depends, on those x-rays that were taken.
Okay. I'm curious why manual decompression adjustments aren't more widely practiced.
Well, it's not actually something that you learn in school as much. You learn that, you may learn those adjustments more from seminars or, your continuing education. And they are actually very powerful moves, and you do need, like for me, I do take films on all my patients, and I make sure that I am able to do that maneuver on patients, because it is a powerful move, and people with, congenital abnormalities or with fusions, things like that, I won't do that adjustment on. So, there are some patients where I won't do certain adjustments on.
Okay, Leonardo, I've been watching your videos for a while. Love your videos. Question, I can crack my back, arms, fingers, and feet on my own, but none of my friends can. Why is that so?
Everyone's body's a little bit different. Some people, they may be afraid to take their body into that position and crack it. It's just, everyone is a little bit different, and, it's not a good thing or a bad thing. It's just differences between, each individual.
Antoine, is the Joint Chiropractic in Riverside, California a good chiropractic company? Debating on going there. They are closed, at least until I can come see you regularly.
So now, technically, I'm not really going to say anything bad about chiros. Everyone has their own philosophies on how they do things. Now, with the company, The Joint, now they don't have or they don't offer on-service x-rays that are taken. So if you go to, The Joint type office, they offer very affordable, cash plans for patients. The only thing is, there's a lot of the patients don't have any films taken on them, so you're gonna get more of a basic type adjustment. Or the other thing, if they do go to take a film, you're gonna have to go to you're gonna be just like outsourced to a different location, to an x-ray facility to get that done. So now I'm not familiar with that one in California. You still gotta realize every doctor is a little bit different, and, just depends on how a doctor practices.
So we had Hydros Apps send us $5. Thank you so much for that.
Thank you so much for that. Was I able to answer their question?
Well, they actually asked one. How often should somebody actually visit a chiropractor?
Okay, so how often a person should visit a chiropractor is going to depend on, one, if they've been currently seeing somebody for some time, if they're brand new to chiropractic, if they're experiencing any certain pain symptoms, I'm like during the initial consult, I'm gonna find out what's going on. I'm gonna look at the x-rays, and I'm gonna compare, and I'm gonna see, what type of care plan that you should be put on. Now, granted, typically in the beginning, I like to see patients, 2 times a week. The reason that I like to see patients, a little bit more frequent is I want to start to get that process of change, so that your body's been misaligned for such a long time. I want to help straighten it, and then I want to gradually bring you down to my goal is always to get people to 1 time a month chiropractic care. Is always my goal.
Sorry, I'm just...
No, you're good, baby. I know we got a lot of glasses.
Christian sent another $5 in super chats. Thank you so much, Christian.
Thank you so much,
We
Christian.
appreciate that.
Let's see, what is that question for us?
He just said, "Stay up, Leah. Thanks for answering my questions."
Thank you. Yeah, no, we're gonna be up. I know every time we do this, we tend to only do like a half hour, but we get going, and we've now, as I see in the timer, 74 minutes.
Has it really been?
Yeah, 74
Oh, wow.
minutes it's been. I just feel that a lot of people out there, you guys have great questions, and it's hard for me to respond back to things, and I would rather do things live like this and go over specific things right here and right now. Yeah, I see that on there. I am going to take a drink of water. I am a little parched now.
Somebody's asking how tall we are.
We are a rather short couple. I am 5'7", and my wife is 5 foot.
Hey, and a quarter. I count that quarter.
And a quarter. So we are 5'7" and 5 foot and a quarter. So yes, we are both rather short.
Okay. Sorry, there's just some comments without questions.
That's fine. Well, here I saw one in there. How much do chiropractors make? Now, technically, it will depend. It depends on if you're an associate doctor where you're working for somebody else's clinic, or it depends on if you own your own clinic. If you're working for somebody else, a typical doctor will start between, an average salary would be between 50 and 65 to 70,000 as a base salary, and then you'll get bonuses depending on like the amount of patients you see or bring in, or there's always some type of bonus structure involved. But the real goal is when you own your own practice, honestly, the sky's endless. It's like owning any type of small business. I know some doctors that make in the millions, and some that they coast at like 200,000-300,000 a year, and it's perfect. They got a one-man operation and they love it. It's low key. That's why you see a lot of chiropractors that have very relaxed hours, don't work weekends, may only work like Monday, Wednesday, Friday. That's because they have a good patient base. They see this amount of patients, and they're not really looking to grow. They're happy where they're at, and that's kind of how things go.
So Guzma is asking, what happened to the hipster model? Are we still going to show the x-rays for her scoliosis?
Aha, my hipster model. She's been kind of in and out of the area. I need to get her back in so we can.
Yeah, she was asking to get adjusted again.
Yeah, but
a week or two.
Yeah, I got to get her back into the office. She'll come by the home office at times to get adjustments. But obviously, the home office does not have an X-ray unit in it, so I'll definitely have to get her into the office in Greenville and get the films taken and updated on her.
So here's a good question. You guys have any merch we can buy? Yes.
Any merch? Actually, yes, we do. We did actually just design some T-shirts. We did it on Teespring. Actually, hold on, baby. Can you pull up that link, and can you put that link in there? Maybe, I don't know. No, it's art. Uh-oh, babe.
Is that it?
Yeah, all you have to do is click that. That'll go back to there. Now go back to the. Yup. Hold on. Sorry, we're technical difficulties right now. Yeah, copy that, or go to this one, baby. Now, hit that URL. Copy it. Perfect. That's it. Copy that. All right, my wife's posting it in right now. So we have a merchandise store.
It's going to be in the comments, by the way.
It's going to be in the comments. My wife will post it a few times in there. Now, the funny thing is the T-shirts that we've made so far are all comments that we've looked back into, and these are all comments from viewers out there. So we're trying to do things, based off of comments that we get from you guys. And everything, obviously, you guys know the comments that we get on the channel. So some things are quite funny. We definitely have a few more designs that we already have in mind. We just haven't actually designed any of the apparel or anything like that yet. But we do have a merchandise store. You can buy right directly from them. I know my wife just put that link in. I'll have her put it in a few times so you guys can see. But yeah, there's definitely some creative stuff. And if you guys have any creative things, like, let us know. I will definitely design a t-shirt with any saying, any picture, whatever you guys think is funny. You know, you guys are actually the ones that are making the t-shirt. We're just putting it together.
Okay, when getting your neck adjusted from C6 to C1, what is the zing that goes down the arm to the fingertips? Can you explain?
Well, you got to realize, so the nerves from the cervical spine, you have what's called the brachial plexus, and the brachial plexus is a bundle of nerves that branch from that cervical spine that go in and go all the way down into the hands and fingers. So depending on what nerve has some type of interference will actually depend on you know, what type of numbness or tingling you may actually have. So, you know, you can follow the nerve roots down. Typically how you look at things is, you know, your C7 nerve root goes to your middle finger, your C6 will be these two fingers, and technically the C8 T1 nerve root will go into these two fingers here, your ring finger and the pinky finger. So typically, you know, when you go in and you see a chiropractor, they'll ask what specific fingers, or they'll ask what specific toes are you noticing issues, because that will actually mean, you know, a difference in, you know, in what nerve root is actually being affected.
Somebody's asking how much you bench.
How much? I have not maxed out in bench in a very long time. I typically don't even max out anymore. I couldn't even tell you. I do everything when I do lift. I do very lightweight and very high rep, just because I've injured myself too many times, and you know, right now, you know, if I injure myself too much and I can't, you know, get into the office and adjust patients, then that's, you know, really affecting, you know, what I do, and I truly don't have the time to waste with overlifting.
Did you expect your videos to go viral?
To be honest, not at all. Even right now, we have 3 videos that are currently just like taking off, and it's crazy how YouTube works and how videos get recommended. You know, the videos that have taken off. Now, originally we put these videos out and they barely got any views for like the first month, and then like a month and a half later, it was like all of a sudden overnight, bam, they just started taking off. And now it's like the same 3 videos that, you know, are still taking off that get majority of the views. So no, I never expected anything to take off, but you know, I'm grateful, you know, it has. You know, it's definitely, you know, kind of made me appreciate, you know, just everyone out there who does view the videos. And you know, that's why we like to do like these Q&A sessions, you know, to be able to explain things and help people out, you know, also.
Christian said, beautiful girls equals viral videos.
Yeah, true. You know, we do tend to see a trend with, you know, an attractive female, you know, getting quite a bit of views. So, you know, always a good thing with that.
What do you guys do on your free time?
On our free time, technically we like to go on walks. We have a really nice trail outside here. We did bike a lot, but to be honest, we left our bikes at at her sister's, my sister-in-law's.
Plus we need to get a baby carriage.
Yeah, now that we have a baby, we got to get a baby carriage for the bike. So originally it was like biking, hiking, you know, just kind
Kayaking.
of kayaking. Yeah, like when we lived in Texas, in the woodlands, we kayaked probably once a week.
Yeah, we did it quite often.
We had our bikes. We went on like nightly bike rides. Now it's a little bit more difficult, you know, with having a child that is very needy. So sadly, it's been a little bit more movie watching and, you know, things like that. But yeah, typically, you know, hiking, biking, anything food. Love restaurants, love trying new food. So things like that are what we like to do.
You can tell we love food. Okay, how many people can you see in a day?
How many people have I seen in a day, or do I like to see? So I've seen a ton. I've seen a stupid amount of patients in a day. I don't like adjusting like that. I like spending a little bit of time with patients. Typically, if when I do adjustments on film, obviously they take me a little bit longer because I'm trying to talk through everything that I do. I'm trying to tell you, as the viewers, why I'm making an adjustment and, what it can affect or not affect, like different things like that. Just because you're not having it done to you personally or you're not here in the room. So there's a lot of things that you can't actually see or pick up on. But yeah, typically my adjustments that I do on patients that you see on video, I can do that adjustment on a patient in 2 minutes, and still hit a full body adjustment.
It's just the fact that you're explaining things
for
the video.
Yeah, it's just the fact that I walk through and I actually explain things.
Okay, so Joe Robertson said, short or not, you're a cute couple and ideally suited for one another. Thank you.
Yes, yeah, we are very suited. My thing was always to find a shorter girl than me, so I think I did that.
That worked. Okay, when getting neck adjustments from, I'm sorry, I already read that one. Recent research studies show that calcium from our bones get leached out from dairy. What's your thoughts on this? Don't know if this is studied any nutrition during the course.
Yes, we do get into that, and so what Dean is talking about is with calcium. It's, to be honest, when dealing with calcium, we'll really deal with things like that through blood work. Like with the nurse practitioner, you can check that calcium levels and you can check the PTH levels, and you want to check if, technically there's always calcium going into the bone and always calcium coming out of the bone. It's a constant, between your calcitonin and your PTH. So it's a constant process that goes on within the body. Yes, I have heard with the dietary, like milk, dairy type calcium is not actually as good for you. Actually, like leafy greens are a lot better for you. Dairy in general is not good at all. Now, granted, when I have coffee, I still have, like a whole milk, or a cream in my coffee. So I still will use dairy, sparingly, when it comes to like milk, but typically we don't really keep it around the house anymore. But yeah, when it comes to your calcium levels, you're always, that you're really gonna want to get that checked with your blood work.
Joseph Nimmons is watching. I'm the one doing the collaboration with you guys tomorrow.
Oh.
We're so excited about that, by the way.
Yes, definitely excited. Yeah, I'm looking forward to having you come on. So we're doing 2 adjustments tomorrow. I will be posting both of them tomorrow. We'll just be posting one of them tomorrow. So very nice to kind of unofficially meet you, but we'll definitely see you tomorrow.
Okay. Do we have any pets or wish to have any? Absolutely not.
No,
not for now.
No pets. We have a baby.
That's more than enough poop to clean.
Yeah, more than enough work with that.
Okay. How did we meet one another?
Actually, we met through a mutual friend. So a buddy of mine, and he's actually a chiropractor as well, and he actually started a YouTube channel. His name is Alex Tubio. He worked with my wife over at Cheesecake Factory, and she was talking to him and was like, gosh, all I'm looking for is a nice guy with a nice beard. And my buddy Alex was like, well, I got one of those for you. And he kind of introduced us, and we kind of first, became Instagram friends and kind of messaged a little bit on there. And then it kind of grew into, with dates and whatnot. And, then at the time I was living in Houston and she was still in Atlanta. So by then it was too hard to keep going back and forth and doing things. So just had to ship her to Houston and call it a day. So that's kind of how things worked with us.
By the way, Dad said you always have Chico. No, thank you.
No, yeah, Chico is my parents' little, oh my gosh, what's the name of the dog?
Little rat.
Yeah, he's like a little rat, whatever. I can't remember the breed that he is, but yeah, no, he's a good dog, but no, he's their pet, not ours.
Okay, I have numbness and finger pain, and it went away. Did not realize it since I started getting adjusted. That is awesome, Chris.
Yeah, no, there's a lot of times, even with patients that'll tell me like, they won't, or they'll forget to mention that they have something going on because it's been going on for years. They don't even like recall or realize that yes, a Yorkie, I see that, Dad. They don't even recall that they're having pain anymore, and then after getting adjustments, they realize that something goes away, and they're like, oh my gosh, I can't believe that was fixed, and that wasn't even my chief complaint.
Mm-hmm. So Liver Die said, I told you you'd go big on here. If you look back at your earlier videos, you'll see my comments. Thank you for the constant support and belief in us.
Yeah, no, I'll tell you right now. Still, even from day one, I had no idea that things were gonna take off how they did. And granted, it's still, anybody who's ever looking to start any type of channel, the one thing that I can say is whatever you have a passion in, for me, it's chiropractic. But, if you're a gamer, if you're a vlogger, if you're a foodie, whatever it is, stick to that passion, show that passion. All your videos show that, like for me, everything is chiropractic related, and your viewers will always see that, and your channel will grow. As long as you have passion for whatever you want your YouTube channel to be, it will grow.
Okay, can I get a chiropractic adjustment if I have a bulged disc in my lumbar spine?
Of course you can. I have many patients that in the past had bulged disc or currently have bulged disc. There are different adjustments that I'll do on a certain patient. Some that are different types of techniques that I'll use that specifically help bring fluid into that area to help relax that disc itself. But yeah, there are multiple different techniques. It's actually called a COX, C-O-X, flexion distraction technique is what I like to do on patients.
Okay, so Stinky Potatoes says, can I have a herniated disc fix itself?
Can a herniated disc fix itself?
I'm sorry, yes.
Yeah, actually with time, and a herniated disc, and obviously if you're taking precautions, if you're not doing whatever you did to cause that herniated disc, if you're relaxing, taking time, taking pressure off that disc, you're kind of watching your movements. Sometimes if you're even in a brace to help keep you in a certain position, things like that. Herniated discs can go away on their own. Things just, will happen temporarily, and, if like a sudden jolt happens to your bone and you have one that slides on top of another, and then it'll come back. What happens is the actual in between the disc may be bulging out like this. Over time, that disc can retract and come back. Now, like I was saying, if you keep aggravating it, no, it will always stay how it is. But, if you baby it and, you ice and you hydrate, yeah, it can definitely get back.
So Guzma's asking, can you get adjusted while you have a herniated disc, or do you have to wait until it heals?
No, you don't have to wait till it heals. There are adjustments that actually help speed up the process of healing. So definitely, if you're looking for that, there's a special technique called flexion distraction technique. Now, I have a table at the office that I do that on, and I actually have not uploaded a video with that technique, so that is something that I will definitely do within some of my next few videos, just so you guys see that type of table, because it is a completely different chiropractic table for that adjustment.
Okay, so any tips for a broke DC trying to start in Texas?
For a broke DC, now a lot of times granted you could work for somebody, making a salary just to get by, or taking a part-time position to get by. Now, actually what we did was I started a traveling company where I went around to different people's homes or offices, and I would bring my portable table around and I would do adjustments like that. Now, granted, it wasn't ideally what I wanted to do, considering having a practice where you're having a portable table. Obviously, I wasn't able to take x-rays on patients, so it wasn't ideal to my philosophy. But, like for me, you got to do what you got to do. You can always find companies to refer, x-rays out to. But yeah, so you could either start up something like that, or, take a position at somebody else's established office.
What's better than a chiropractic husband? I don't know.
Yeah, she gets adjustments, whenever she needs them, so, must be nice.
Oh, it is. Okay, a question. Is it possible to do chiropractic treatment for people with disabilities, and how should the treatment be carried out?
Yes, I have had patients with extreme ADHD cases where, like, they were very extreme in what I had to do as a chiropractor. I had to do different techniques because you had to get the patient relaxed as best as possible. So they would actually respond very well. A lot of the times, like parents would bring their children in, like very bad cases of ADHD, even any types of, like mental retardation, any things like that. I've dealt with, I have adjusted many patients like that. And it's just finding a way to get them relaxed when doing the adjustment, and they'll respond very well, with the care.
What is your biggest pet peeve?
My biggest pet peeve, I like to keep things clean, and it's hard to do so at times. And I expect my wife to keep things clean too. I need everything spotless. Actually, you know what? No, my biggest pet peeve, junk. I hate junk. I hate knickknacks. Any type of knickknacks that ever build up, I toss that right into the garbage.
He has trashed so much of my stuff.
I don't do knickknacks. I don't do junk. Like little trinkets. Nope, I don't want it. Put it right in the garbage. Get rid of it. It's clutter. I hate clutter. Things like that. Yeah, kind of annoy me.
Okay, what is the best cure for a bad knee? Don't tell me an operation.
It will depend with a bad knee. Just because with certain testing, you could see if it's like a certain ligament tear. It could be a collateral ligament. It may be your meniscus, your medial or lateral meniscus, or your medial or collateral ligaments as well. It just depends on where in the knee. And, if it is a meniscus, if it is a tear, if it's something partial, granted, it could only be fixed with the surgery. It just depends on what is going on. Now, even things that we do at the office that are a little bit different, we do regenerative medicine, meaning we do PRP and we do stem cell therapy. So we do, the stem cell injections, which will help actually regrow tissue in the knee. So it just depends, but not everybody is a candidate for that. So definitely go through, your testing, and you'll have to see if you are a candidate for different types of techniques.
Okay, so how did you manage the cost of your education?
All my education is put on student loans, and I don't think I will ever finish paying off those student loans. So, hopefully YouTube channel will help me out, because 4 years of living on student loans, and it paid for everything. My student loans paid for my housing, it paid for my bills, it paid for my food. By the time I graduated with interest and everything, dude, I'm at like $280,000 in student loan debt. So that's right now just a minimum payment that I make monthly, and that's all. We're gonna just chip away at it. That bill's probably gonna be in my life for 30 years. So
I get into this marriage debt free, and then here's this one, $300,000 in debt.
Whatever.
All right, so Joe Robinson.
Thoughts on side posture adjustments. So I do perform side posture adjustments on patients. Now, granted, I don't do it on all patients. And the reason I don't is, yes, because of size of a patient. Sometimes with a bigger or a larger patient, I won't do a side posture just because I'm not trying to throw my shoulder out when doing the adjustment. Also, on some people, if they have what's called DISH or AS, DISH would be diffuse idiopathic skeletal hyperostosis, or ankylosing spondylitis. Those two conditions tend to make people very stiff. So trying to get them in a side posture maneuver is very hard and very unlikely. So those types of patients, I will not side posture as well.
Okay, where do we live?
We are located in Greenville. We're in a beautiful loft with like 18-foot ceilings and actually amazing place. So yeah, I love where we live in Greenville.
Oh gosh, yeah. Have you ever adjusted anyone by elbow dropping on their back?
No, this isn't wrestling or anything like that. I've never elbow dropped. Now, granted, the standing adjustment where I put people as what everyone calls the full Nelson. Yeah, I will do that one, but yeah, no elbows into the back.
No. Okay. Is it awkward when you ask people if they're cool being on YouTube?
Now, to be honest, I get a lot of people that don't want to be on YouTube. Now, I get a lot of people daily. I get emails daily from people, but no, I don't always, I get a lot of people that are like, no, your comments are awful. We don't want to be on there because of the comments. And I completely respect that. So, the people who do want to be, filmed, I offer, a free adjustment for those people, in exchange for, doing the YouTube video. But yeah, if not, then I have patients come in the normal way, through the office and such.
Okay, bilingual.
I am not bilingual. My wife, on the other hand, if we have any Russian, Ukrainian speakers out there, my wife speaks Russian. Her family is all from Ukraine, so she is the bilingual one of the two of us.
You done with Ace Thayer and his neck-only adjustments?
Well, I don't know who Ace Thayer is, but I don't practice, just the neck adjustment only. I like to adjust, the full body. And to be honest, with me adjusting the full body, I get a lot of people, from all over the world that actually want to come and see me because their chiropractors won't do what I do. Or, I guess, that's not their technique. They don't want to do it. They don't do it. So, I get a lot of people, even in the Greenville area, a lot of people, and I feel bad, but they change chiropractors because, their chiropractor isn't doing what they fully are capable of.
Okay. Favorite sports?
Favorite sports? I grew up, I played soccer my entire life, and golf. Golf I was always okay at. Always hard to keep up. I was never as consistent, but I did start both when I was rather young. Soccer, I actually had quite a few buddies who have made the MLS, and I was right there. I could have, if I actually stuck with it, that was something, that I know if I did stick with it, the MLS would have actually been something I could have done. Back in the day, it was like ODP, the Olympic Development Program that I was on. Things like that. So I was actually, very good in soccer, and I will 100% push that on my son. And hopefully, when my son gets older, I can get him to have a soccer YouTube channel and teach him, everything, hand down everything that I learned to him.
Joe Robinson said, "Amen to clutter." You guys are officially best friends. Okay, favorite food.
Favorite food, honestly, I love carbs. Pizza, pasta. It depends on the mood. I mean, sometimes, even like a Mexican, it really depends on what I'm feeling like. Or those are time like I like a nice filet, or, even times where I even like, like a, maybe a fattier cut. There's one restaurant where I'd always order a Hawaiian ribeye. I'm always your steak, your potatoes, your pizza, those are, top things of mine.
Sorry, 1 second. We are bringing all your soccer trophies.
No, Dad. Dad, you are not allowed to bring all those soccer trophies down here.
We don't need them.
Yeah, that is clutter in my book, and I cannot have clutter at my place. You guys need the memories, from me as a child. So that, that should be, just memorabilia.
That's funny. Greetings from Peru. How awesome.
Hi from Peru.
Does the adjustment fix the curved neck?
So I can get with adjustments and with proper strengthening and stretching techniques, we can help get the proper lordosis back in the cervical spine. Yes.
RD says, since last night, I just want to ask you, when do you
Do the neck adjustment. Is it safe? It's so scary. Yeah, no, to be honest,
Scary to watch.
I'll do a neck adjustment on any patient. I'll look at what their x-rays show and I'll, adjust accordingly. Sometimes I'll do more of just the manual decompression, or sometimes I'll do the manual decompression with like a rotational type adjustment as well.
How do you adjust tall people?
I actually have a couple patients that are like 6'5" and taller. It's kind of funny, but the table is low to the ground, so it's not an issue. The only funny thing is when I try to do the full Nelson move on the patients, because I got them leaning down so far. That's actually rather funny.
Yeah, I'm getting him a step stool.
Haha.
This is gag gift. Okay. How much does a full adjustment go for?
I mean, all our adjustments are the same, full and normal, but we do $40 for a single adjustment for cash patients, or we do $59 for 3 adjustments per month.
Joe Robinson is saying, sorry he's so chatty tonight.
Don't be sorry, it's completely fine.
This is why we do this.
Yep.
What do you think of the ring dinger?
I mean, I've got no complaints on the ring dinger. It's a very powerful manual decompression type technique like mine. I'm definitely glad to see other people doing that type of adjustment, and great that the response that people get from it is literally outstanding.
Are you gonna come to the UK?
I gotta look into the laws of the UK. I know like Italy has certain laws and certain testing that needs to be done. So it's a little bit different with out-of-country license.
So Tony said, Привет, wow, Mama Sip, you don't have an accent at all. I was born here in America. Most of my siblings were still born
Well, why don't you say
in Ukraine.
Why don't you say it in Russian to him?
Because what if he's not Russian speaking?
Well, say it to him in Russian, and then we'll find
Я
out.
родилась в Америке, so that's why I don't have an accent. Моя семья, все с Украины, but я уже здесь родилась, как я сказала, so no accent whatsoever. At least I don't think so. Okay, do they teach different techniques? Just curious if you develop your own or it's recommended a certain way.
Yes, they teach in schools multiple different techniques. There are, some of your major ones that everyone does learn. Your full spine, your Gonstead, your diversified toggle. Like some of these techniques are your main ones that you do learn. Now there are so many more that that are actually in the world that are practiced but aren't actually in curriculums. It's things that you have to do on your own time to learn.
What's your thoughts on stretching exercises?
Oh, I mean, stretching goes hand in hand with chiropractic. The muscles and ligaments are connected to, certain locations on the spine or other, parts of the bone. And, if something is out of alignment, it's going to pull that muscle or that ligament out of alignment. So, yeah, it definitely goes hand in hand.
Okay, how much does a full adjustment go for?
The adjustments that we do are 40 for a single adjustment or 59 for 3 adjustments a month. I saw a comment on Tech Neck. Yeah, Tech Neck is actually a real thing. You'll see a lot of, it's not even just with younger generation. Everyone now has, a phone, smartphone, iPhone, Android, whatever, and they're looking down, on their phones, very frequently. So yeah, they tend to lose that curve in their cervical spine. So yeah, it's helping retrain people to get that curve back in their cervical spine.
Okay, also on foam roller stretching, foam roller exercises, any thoughts?
Yes, we have a physical therapist even at the office. They'll do certain stretches, certain exercises. Some foam roller maneuvers are good. Some work better if you have like a functional medicine type maneuver. So instead of just being stagnant, like putting something in motion while doing foam rolling, does also work as well. Also, like with the tennis ball or lacrosse ball, those work really well too.
I'm a 50-year-old, this is Dave, by the way. I'm a 50-year-old man and have never been to a chiropractor. I occasionally have lower and upper back pain. Is it safe, or is there any chances of injury getting adjusted?
Dave, so one thing that you want to do, granted, you know, there's a lot of people, and I have a lot of patients that are even in your boat that come in because they've seen my videos and have never been adjusted. What I do with every patient is I put them through a full, complete workup. So I put them through a bunch of ranges of motion, orthopedic tests. I want to see what's going on, what's recreating that pain, and then from there I'll take images of the spine. So I'll look at the cervical spine, the thoracic spine, and the lumbar spine, and I'll find out what adjustments that need to be made on a patient before making an adjustment. So if you go to a chiropractor, definitely get films taken.
So Eric said if he could adjust any animal, what would it be and why?
To be honest, I have not taken any classes on animal adjusting. I would say I've seen like a horse getting adjusted before, and that would actually be really cool to do it myself, just because of, you know, how massive of an animal that is, so, and how large their vertebrae are. So that would be kind of cool.
So somebody said they want to see our baby. He is
our son,
down for the night.
Yeah, he's sleeping. We're definitely not waking him up.
Nope. It's late. How are y'all still doing this? It is late, getting late.
Yeah, it's getting late, but it's fun. We, you know, have, you know, nothing else going on this evening, so would have, you know, have fun spending it with you guys.
Why is there an ASMR reaction when we watch chiropractic videos?
A lot of people have such like a relieving type like response to the videos. To be honest, I never realized like the popularity in that at all. But yeah, people love it. People really like to hear the cracks or see the adjustments being made. And a lot of times it's almost like mind over matter, and you know, they feel like, oh my gosh, it just feels so relieving. And yeah, you know, people just really enjoy it.
1 second. Okay. How long have you been a chiropractor?
I have been practicing for almost 4 years now. Yeah, it's been, you know, not the longest time, but the first clinic, like I was telling you guys earlier that I was at, you know, it was an office where we were seeing, you know, a little over 2,000 patients a week. So I've adjusted more patients at that office than, you know, most chiropractors have in their entire lifetime. So yeah, my experience of, you know, actually adjusting patients has been extreme. And I have done mission trips to Haiti and Dominican Republic and have adjusted thousands of people, you know, in those regions as well.
Okay, so Chris says, I won't even try with that last name. Sounds Polish. I wish my gym teachers would have stressed the importance of stretching. Once you lose range of motion, it's not easy to get it back. That's true.
Yeah, no, that's 100% true. A lot of times, you know, you need to warm up a muscle properly before, you know, fully exerting it, and you know, you can definitely cause a lot of, you know, damage, you know, to an area.
Sorry, there was some that I had to remove.
That is completely fine. Let's see, my wife's going through trying to find some more comments. Are you Christian? Yes, we are Christian.
Favorite TV shows?
Oh, hold on, you got this one. This one's
I
to
know,
you,
I
babe.
saw that actually. That's funny.
Hold on, my wife is going to answer this
Owner
one.
of PMC, you said, I speak Bulgarian and some Russian. I live in Varna, Bulgaria. I get adjusted every 4 weeks. I'm a gymnastics coach. That's awesome. I actually have 2 brother-in-laws who are Bulgarian in my family, and we do speak Russian. I don't know if you heard before. So good to meet some What do you think of the 10 unit machine?
Honestly, I love the TENS unit machine. I currently, well, I have my own portable one. I gave it to my brother-in-law's mother. She was having some low back pain, so TENS unit, yeah, I mean, it's like an old school technology, but currently, yeah, I've used it. It's helped. It's like done wonders for myself. Now, I would not go to an office and pay for it. You can find a portable TENS unit online, like on Amazon, for like $20. I would never pay for it. I would never charge anybody at the office to use a TENS unit, something that you can pay for on your own and have in your everyday home.
Dad said, talk about Haiti on how and what your experience.
I will get more into Haiti on my book. So I'm currently in the process of writing and publishing a book. So I've been in contact with some people. Actually, one is a patient of mine, and I've met people through my profession. And this time I met somebody who is a great influence and has gotten me to actually start writing my own book. So I'll definitely get into a lot more specific stories and really get into chiropractic, what it means to me, and then also just about I'll definitely get into it more and get way more in depth, around the time where we're gonna be going for sale with things.
Okay, so somebody's asking for Christian.
Well, I already answered that.
You did? Okay.
Yeah, that's my love.
Have you visited LA?
Actually, I've never been to California before. I would love to visit LA. There's a lot of people out there that have, even asked to do collaborations with me. And, I would definitely love to go out there and, bring my portable table and do something. But yeah, I've got to look into the laws of checking in for like a temporary license.
So Dino, Joseph, when people crack their necks by themselves by just bend right and left, is that safe, and does it have the same effect as a chiro adjustment?
So technically, if doing one of these, like bending to the left and right, like you said, now yeah, you may get popping and cracking, things like that. Can be good, can be bad. The thing is, if you're just bending and you feel it like a pop or a crack, that's not going to be bad. What is going to be bad is when you start doing one of these and you're starting to force something, into a different position, just because you don't know what you're moving. Now, just with the bend, yeah, no, that's not going to be an issue at all. But definitely don't force anything, especially in the neck.
Live or Die said, do you ever get any patients who are so pleased they come back to see you just to bring you a gift?
I have had patients bring a gift. It's funny, I've even actually had, when I was moving out of Houston, I had a couple patients that, cried because I was leaving.
I know,
And
I remember that.
she remembers it too. Some that were very sad because they loved my adjustment. They never experienced anything like that before, and were definitely devastated for me leaving.
Okay, so what are your biggest accomplishments?
Well, I would definitely say graduating school would be one. Another big accomplishment would be marrying my wife and starting a family. I know, baby. But yeah, no, right now it's currently accomplishments. We're really trying to grow the channel and spread the word of chiropractic to the world.
Okay, why do different chiropractors have such different styles and methods?
Everyone is, taught and trained multiple different techniques. There's not just one technique out there. There literally is hundreds of different techniques, and depending on what type of doctor does what type of technique, is going to respond to the care. Now, granted, one chiropractor, may adjust a certain way, and I may adjust completely different, and you may get the best results from me, or you may not get any results from me, and you may get results elsewhere. It just, everybody's bodies react differently, and what works for one may not work for another.
So somebody's saying, will you make your book into an Audible?
I haven't thought about that. I know that we are going to be doing an ebook, and it's, it'll be like that. It won't be anything crazy long. But yeah, there's a good chance, especially with having the ebook, that we may do an Audible as well, so you can, listen to it in the car, things like that.
Don't Hack Luigi's asking why I'm so curvy. It's called After Baby Body. All right, most funny experience with a client during an adjustment.
Well, I am not gonna lie, but it has been funny when making an adjustment on a patient and you hear a very loud fart. Patients tend to get very embarrassed and apologize numerous times, but yeah, I would say that is usually the funniest thing that happens is, getting somebody to fart.
All right, any funny reactions when receiving an adjustment?
I've had people scream before, especially with the Y strap. There's some people I wish I had on video with the Y strap because they screamed bloody murder and were like, oh my gosh, I was not expecting that. And just their reaction was priceless. But yeah, some of them, I wish I was able to get every person on video.
Okay. Are you guys in the DC area?
No, unfortunately, we are in Greenville, South Carolina.
Okay, and are we visiting the UK? I think it's somebody else.
Yeah, no. When it comes to out of country chiropractic care, I gotta look into the different laws and licensing in each country.
Can I see a chiropractor if I've had cervical spinal fusion surgery?
It depends. You can, as a chiropractor, you do not ever want to adjust on an area where there's been any type of fusion or any type of surgery that's been done, but you can adjust above or below that level.
Do you ever fly out to adjust or do you stay local?
Typically I stay local, depending on, laws and regulations, things like that. But I would never be opposed to anything.
So Audrey is asking, my rib closer to the bottom on the left keeps popping out of place randomly. Recently, it aches very hard until it pops back into place itself. How do I make it stop popping out of place? It sounds so painful.
Yeah, those are hard. Especially rib adjustments are, a pain living with, just because when a rib is out of location, it can push on the lung, and then you have pain, with the deep inspiration. Yeah, a lot of times, I'll have to do adjustments to pop a rib back in place, and then after it does get back into place, definitely like to get somebody to either get an actual massage done or some type of soft tissue technique, so to help that rib from coming out of place again.
So Doug is asking, what is a crack popping sound when a joint is adjusted?
So all that is, it's just gases that are being released from the joints. When it's in your neck, obviously it's heard a lot louder because your ears are a lot closer to your neck compared to your fingers being adjusted.
Okay, what is the Palmer method?
Well, the Palmer method would be an adjusting style only taught at Palmer College. There are a couple Palmer campuses, that are around the U.S. I currently am not a Palmer graduate. I graduated from Life University, so I don't actually know that technique.
Beard growing tips?
Trim up every now and then, but yeah, just let it grow. Oils are good. I do an argan oil, and that I tend to see quite a bit of growth.
Okay. Dino said the cracking sound. A friend of mine who is a graduate chiro said it's not the bones but air bubbles.
Correct. Yeah, it's gases being released from the joints.
I'm sorry, 1 second. I have to take care of that.
Yeah.
Okay, who adjusts you?
I have multiple chiropractors at the office, and I'll have another one of the DCs at the office to adjust me.
Okay, did you choose the chiropractic as a hobby at the beginning?
No, I actually wanted to get into a field where I could better other people's lives. I really wanted to make an impact, and Honestly, this field kind of chose me. I'll definitely get way more into detail in the book on just what I experienced and how I came about choosing the path of chiropractic.
Okay. How's the hurricane where you guys are? Somebody must have already asked.
Right now, the hurricane has not hit Greenville. We should be expecting it tomorrow afternoon in this area.
That should be a t-shirt, babe. He didn't choose the chiropractic chose him. In a Russian accent.
Yes, anyone, hold on, we do have a merchandise store, and our merchandise store is from comments that are created by the viewers. All our t-shirts are created from you guys. We find funny comments or things that stick out, and we've started creating t-shirts like that. Baby, can you put up a link again?
Of course.
So
I'll go ahead and put it in the comments.
My
guys.
wife is going to put a link in on the comments. It's actually kind of funny, you'll see. And if you guys have any ideas for any more t-shirts, please let me know.
Okay. What is your first profession before being so slick?
I was actually a medical assistant. I worked in a chem lab. I did processing of blood work. I would spin it down, with the centrifuge. I would split off, the red blood cells and white blood cells, and I would bring it basically to the different departments. If it was coagulation, hematology, blood bank, I would get things over to this specific department. So basically, I prepped tests. I was working at a hospital before.
If you don't take spinal fluid out soon enough, what will happen?
It depends on what is going on. If you're, there's so many things. A normal person, you never need to take spinal fluid out. Your body's homeostasis is regulated by it. But, if you're looking at some type of, brain injury or, skull or spine injury, then, that's something that you definitely need to monitor.
Okay. Hey Joseph, had an ATFL repair with the internal brace, no pins to limit ankle mobility. Would chiropractic help with scar tissue repair or removal on ankles?
With something like that, first off, especially when it deals with the ankle and that you had, with the bracing and everything, I would first do maybe a cold laser therapy. Cold laser therapy will help rebuild the tissues in that area more rapidly, than not doing anything at all. There was a video that I was showing. I actually used cold laser therapy on a spider bite to help that tissue. So that's one thing that could help, with your issue going on. Also, if it's a little bit further, I wouldn't do adjustments personally on on this situation. If it's something like that acute, I would wait a little bit before doing an adjustment on the ankle.
So Joseph is asking, can I get a free adjustment? I'll fly out from Michigan for it.
If you fly out from Michigan, of course. And actually, what part of Michigan? Because I am actually from Michigan also. So I'll wait for you to answer that one.
Okay. Would you prefer your son to be tall or short?
To be honest, I think he's going to be tall. My father is actually 6 feet tall, and he's above average in height and weight and head size. So, yeah, I think he's going to be well taller than the both of us.
Can an adjustment help with constant hip popping during a squat?
It depends on what's actually popping out. If it's, it could be an IT band that keeps snapping, or it could be something with the actual ball and socket. So for the most part, yes, it could help, but without doing proper, orthopedic tests and taking films, it's hard to determine that.
So somebody's asking, you didn't explain where you stole that model next to you from.
I took her from Atlanta. And I've been moving her everywhere that I go.
I have a foam roller, and when I lift and extend my head upward and my spine cracks, is this a reliable traction adjustment method?
If you're just using a foam roller and things pop or crack, Yeah, it's not like you can help it by all means. So, anything when it comes to a self-adjustment where you're trying to force something, that's when it, turns into something not good.
Joe Robinson's saying, looks like we're traveling to South Carolina now. Would you consider working on traveling weary psychologist from Texas?
Of course we would.
Okay, read the next one. 1 second.
Okay. Oh, there's someone on here that's very hilarious that we need to block. Would I recommend essential oils for helping tissue relaxation? To be honest, I'm not 100% familiar. Like, that's the essential oils I never actually learned in school. That's not any type of topic that we do learn. So I wouldn't be the best one to ask about that. Now granted, yes, I have heard about, essential oils and, and all their multiple effects, that it can happen. But I mean, I'm not the one to ask for that. And, I'm the first one to tell you, if I know something, if I don't know something, I'm not going to BS an answer just to say something.
Can an adjustment cure cancer?
I would never say that an adjustment can cure cancer. I would never say an adjustment could cure anything. But what an adjustment can do, it can relieve pressure off a nerve. Now, when you relieve pressure off a nerve, what your body can do, it could, stop you from having pain. It could stop you from having a headache. It could, there are multiple things that an adjustment can do, but you can't really say that an adjustment can cure anything because it's actually the person's body, it's one's own body that does anything. Now I do actually have, and I'll talk about in my book, some patients with cancer and chiropractic care. So I will get into that, in the book.
Okay. Would you recommend essential oils for helping tissue relaxation?
I
you already did that? I'm
yep.
sorry. I was not aware.
Oh, any role models? Actually, when I was a kid, my role model was actually Michael Jordan. Yeah, dude, I loved the Chicago Bulls as a kid. I was a huge fan of Jordan. He was, like even me growing up, I watched the, oh my gosh. Dude, I can picture the team, the Toon Squad. Like, I know everyone out there knows exactly what I'm talking about if you're, born in my day and age. Michael Jordan, the Looney Tunes, that movie, literally, my dad could tell you, I turned that thing on repeat.
Space Jam?
Space Jam, thank you. Space Jam, that was my favorite movie as a kid growing up, yep.
Okay, are you going through it?
Yep.
Okay, cool.
Why don't you make a side daily or weekly videos about you and your life with the family, like other YouTubers? Actually, I could. I could definitely do.
If that's something you guys would like.
Yeah, if that's something you guys would like, I would definitely go over, like things that we do, activities. I'd even, with my wife wanting to get more into working out again. Yeah, that would definitely get into.
Mm-hmm.
I would not have an issue with that at all, considering, we have cameras on us quite a bit. Let's see. Yes, do I work on sprained ankles? I will work on a sprained ankle, but not anything that's recent. If anything's inflamed, no, I typically want to wait until the swelling has gone down first. Let's see, let me scroll down a little bit. So I was seeing, Kobe or LeBron. I mean, that's a tough one. Yeah, Kobe's got a ton of rings. LeBron's killing it though. I don't know. I think I would have to go with LeBron. So, yeah, LeBron. Even like right now, currently, dude, that guy, he's an animal. He's a great athlete, and he's one person out there that he invests in his body because he knows that his body is his it's his bread maker. It's everything to him. So he watches, everything that he eats, everything that he does, between the workouts, the nutrition, the care for his body. Like that guy, he invests in himself, and that's what an athlete needs to do. Yep, I see everybody with the Space Jam comments. Yeah, that was like my favorite movie growing up. Definitely love Space Jam.
Your dad's asking, what about Hook?
Yeah. I tend to watch the old school movie Hook with Robin Williams. Was another fan favorite of mine as a kid. Let's see. Yeah, Dean again. When you relieve pressure, it allows your body to heal better, so adjustments contribute to health. Yeah, no, that's exactly 100% correct. Yeah, relieving pressure off the spine will help the body, heal and function better. Yes, that comment right there. None of them are better than Jordan. Dude, I'm not gonna lie. Jordan was my, he was my boy. Definitely have a ton of mad respect for him. But I mean, I can't ever say, one is better than the other. They're different time eras, just different things in general. Yeah, I'm not gonna say Jordan's better than LeBron or LeBron better than Jordan. They're both completely different builds. LeBron, I mean, he's a tank. He's bigger. He's more muscular. But Jordan, dude, his threes, yeah, completely different type player. All right, let's see. We are just gonna do a couple more.
I was just looking at the time.
Yeah,
it's 11:30.
Yeah, it's getting late over here, so let's see. I'm gonna look for a few more, and then we're gonna sign out for the evening here. Okay. Well, what do I think about the diss between Eminem and MGK? Dude, I don't follow any of that. I mean, yeah, Eminem, yeah, he's a Michigander like me. He's from 8 Mile. I'm from a little bit north of 8 Mile, but yeah, we're from the same neck of the woods, so I would definitely be an Eminem fan when it comes to that. Does the pretty lady have anything to say?
Do I have anything to say? Go check out Mama Sip, my somewhat vlog. I just kind of post random videos on there. I am starting to do, or I'm gonna start doing like a fitness journey. Just trying to get, out of my mom bod and back to where I used to be, or somewhat, relatively close. So I'll be posting those videos here soon. Go check me out on Mama Sip, and I'll go ahead and comment below so you can actually see how it's spelled out.
Yep, and
I would appreciate that.
And definitely everyone, so we're gonna sign off after this, but so my wife's putting in her channel name, and then I'm also gonna have her put our link to our, it's a Teespring account, so you can go right on the website that she goes to put up.
Yep.
And all of we've only designed 3 separate designs, but everything that we do, it actually comes from you guys and from the comments that we get on our page. So if anybody has any funny comments or any cool designs or funny sayings for a t-shirt, let us know, guys. Thank you, everyone.
Good night.
Yeah, we had a great time. Have a good one, everybody.